Hi guys, I'm going to be doing my presentation today on platelet-rich plasma, or PRP as you guys may know it as. I have created a PowerPoint with a list of my references on there, as well as a slide that we're going to reference later in this talk. It's a visual aid, so it might help you guys understand a little bit more of what PRP does and how PRP is done. So platelet-rich plasma, or PRP, is rapidly gaining popularity in today's orthopedic and athletic setting. Despite all the advances made in the medical field regarding different training styles and equipment, injuries sustained in the athletic setting are still very, very common. One study found that approximately 50% of these common injuries are actually due to overuse. And we all know the common overuse injuries compared to acute injuries. You know, you have your tendinopathies versus your muscle strains. And we continue to treat these common injuries with common treatments as well. You know, you have your NSAIDs, your rest, or even injectable steroids. But is that truly the best way? There may be a new way to treat these common injuries without excessive time lost or without causing detrimental effects to the body. PRP uses one's own body as a healing agent. So PRP can be used as a non-surgical treatment for tendon, ligament, and even muscle injury. Platelets are known throughout the body for their really important contribution to clotting. However, these platelets contain hundreds of proteins, or what you and I can call growth factors, that are vital to the process of healing injuries. When these platelets are activated, they release these growth factors, and then those attract other stem cells that help in this regenerating process of injured tissues. Once blood has been drawn from the patient, these platelets are separated from other cells, and the concentration of those platelets are increased during a process of centrifugation. Okay, this is when we're going to pull up that PowerPoint and look at slide number 4. As you guys can see in this picture, or it's actually slide number 3. When you guys can see in this picture, once the blood is collected, the vials are spun down to separate red blood cells, white blood cells, and platelets. So that top layer that you guys can see on there, that yellow layer, that contains all the platelets needed for injection. Then they take that top layer, that yellow layer, and they empty that into a new sterile tube, and then once that's occurred, they spin it down one more time. And then that fraction of blood that contains all those platelets is collected for injection later. The concentration of platelets and growth factors in that little yellow portion that you guys can see there is up to 5 to 10 times greater than normal blood. So once that PRP has been prepared, it can be injected into that area of injury. The area of injection is then cleaned and anesthetized. While administering the anesthesia to the area, the physician also irritates the tendon or ligament by what they call peppering it. So what that means is that he will poke small little holes in the surrounding muscles, ligaments, or tendons. As you remember, when a tissue is injured, that's when the platelets are attracted, and then they release the growth hormone, and then they begin all those other healing processes. So that's why he's going in there and peppering that area as well to help facilitate that environment for the PRP. Once that is completed, ultrasound is used to guide the physician in delivering the concentration of platelets directly to that site of injury. Just as in any procedure, there are certain risks to be considered. However, the risks associated with PRP are very, very minimal. The only thing that they really listed was pain at the injection site. Unfortunately, the incidence of other issues like infection, tissue damage, and nerve damage seem to be no different than the risks associated with PRP or with cortisone injections. So as you can see, the risks are very minimal for PRP. It's thought that PRP accelerates and promotes early muscle and tendon healing, and it can help stimulate that repair process that we talked about earlier. A review of this method mentioned that it thought PRP would improve and facilitate functional recovery, and then possibly allow early return to function and competition for athletes. One study actually reviewed the effectiveness of PRP and found that there was good evidence to support one PRP injection under ultrasound for tendinopathy. There seems to be a call for more research on the topic of PRP. A few studies out there hold promise in the claim that PRP is very effective. However, more research needs to be done to actually back up those claims. Okay, so on the PowerPoint, the first article that we're going to talk about is the Platelet-Rich Plasma, a review of actions and applications in sports injuries. This article was very helpful in breaking down what PRP actually is. It gave examples of tissue healing, and broke down the various processes in ligament, muscle, and tendon healing, and it really showed PRP's usefulness throughout the medical community. The next article we're going to talk about, this study was done on muscle, bone, and tendon cells. So the purpose of this was to see 3 different separate PRP preparations. So they had 8 participants, each yielding a different, each were given a different PRP preparation. So the first one was a single spin, which yielded low concentration of platelets. So back to that centrifuge, they didn't do it twice, they only did it once. The second preparation was a single spin that yielded high concentration of platelets and then also a high concentration of white blood cells. The third spin, they spun it twice and it yielded a high concentration of platelet concentration, and then it also yielded a lower white blood cell concentration, unfortunately. And it was found that the application of PRP has a very beneficial effect on those target cells, so those injured cells. The article basically says that PRP is beneficial in regards to tissue healing. The third article that I used, the purpose of this article was to investigate one single PRP injection in the treatment of grade 2 hamstring injuries. So they had 28 patients here with diagnosed acute hamstring injuries. They were assigned to one of 2 groups. The first group had PRP therapy combined with the rehabilitation group, and the second group had strictly just a rehabilitation group and no PRP injections. The results showed that the patients in the PRP group achieved full recovery significantly earlier than the patients just in the rehab group alone. It showed that the PRP was significantly more effective in treating hamstring injuries than just the rehabilitation program alone. Unfortunately, there was no significant differences reported on pain. The final article that I used talks about chronic tennis elbow. So the goal of this article was to evaluate a single injection of PRP with patients with chronic elbow pain. So they had 230 patients. 116 of those patients received PRP, and then 114 of them were in an active control group. These patients were then followed at 12 weeks and then at 24 weeks. No significant differences were found at 12 weeks in the study, as you guys can see on that one. However, at 24 weeks, there was clinically meaningful results and clinically meaningful improvements found in the patients treated with PRP compared to the control group. So since research is lacking in the field of PRP, hopefully this presentation has made you guys want to go out and do tons and tons of research on PRP. Thank you.